A Real Money team is back, saving you a lot of money on your doctor bill. Americans on average spend up to $200 for each doctor visit. So imagine being able to visit your doctor without leaving home and cutting the cost in half. ABC's Paula Ferris with a way to keep that money in your pocket.
With 3 growing boys, the Allspaws from Dayton, Ohio say their home away from home is often the doctor's office.
We really do have a stack of medical bills, and it overwhelms me.
For the boys, $90 each visit, $100 for mom and dad, and the costs are adding up.
Just wondering, is there a better way?
According to our healthcare consumer advocate, Michelle Katz, there is. It's a brand new high-tech medical service called telemedicine. Telemedicine is already backed by many hospitals and major health insurers, even Medicare and Medicaid.
Hi.
But for most families, Michelle says they don't even know it's an option or figure in the extra costs.
It costs money to take off from work, to get all the boys in the car, drive down, to wait a few hours to get a diagnosis that you might already know about.
It's used to treat minor ailments like cold symptoms, which alone account for nearly a quarter of family doctor's office visits.
It's starting here.
Phil's trying it out for what he thinks is poison ivy.
Well, it'd be $100 just to tell me that I got the poison ivy that I know I have.
Taking a picture.
I have the picture.
Uploading it and answering a few questions. Hello. An hour later, Phil gets a call from a doctor, a prescription, and fills it at his pharmacy.
We've got a very affordable alternative to an emergency room for non-emergent care.
Dr. Howard says telemedicine is to help families stay healthy in between regular doctor's office visits, not instead of them.
Your best care is always going to be your primary care physician with a hands-on exam.
In all, Phil's bill was about half of what it usually costs him to visit the doctor's office, and Michelle estimates the Allspaws can save more than $2,600 just this year.
I'm amazed. I am simply amazed.
That's real money! Now, the telemedicine doctors that we spoke to were highly credentialed. We're talking 15 years of experience and up. To find out more, you can go to our website where Michelle has laid out what to look for in a telemedicine doctor. And Diane, have to emphasize, this does not replace your primary care physician. It only acts as a bridge. And again, it applies to basic and minor ailments only.
And that poison ivy cured?
Cured. $4 prescription.
Okay, thanks so much, Paul.
It's tough to make yourself get out of bed when you're sick. Add in the cold temperatures and you really don't want to leave the house. But as Dan DeRose shows you, these days, technology can bring the doctor right to you.
That's right, David. This is being called telemedicine. It's one of the leading companies in this is a website called MeMD. Now, with just about everybody having a camera on their smartphones and their tablets, the days of heading to the doctor's office may no longer be necessary. Today, I checked it out, got registered with MeMD, and the doctor that I got to visit with on my tablet was actually in Spokane, Washington. Now, the doctor asks the same questions that your physician would in a doctor's office. Have you taken your temp? Are you achy? How long have you been sick? The doctors are all board certified, and they have to be licensed in the state that you're in. Now, the drawbacks, yes, it's a little impersonal, but the positives, not having to leave your house and sitting in a doctor's office for a couple of hours with other sick people. Now, the doctor we talked to says that when he started doing virtual visits 4 years ago, he would only see 1 or 2 patients a month. Now, he sees 40 to 50 patients a day. They can write prescriptions, and again, we're just talking for the minor stuff, colds, fever, flu, that kind of stuff. Live at the big board, Dan DeRose, 19 Action News.
Tonight, some Colorado doctors telling people with flu symptoms to stay away, and they're using telemedicine to diagnose from afar. 7 News reporter Jacqueline Allen is live at CU Hospital in Aurora, where, Jacqueline, they've seen a dramatic spike in flu hospitalizations there.
That's right. They're telling anyone who comes in here with flu-like symptoms to wear a mask like this one here whenever they come into the hospital, basically because they've had as many hospitalizations for flu so far just in the last month as they did in the entire flu season last year. And some doctors across the state are being even more cautious. At every entrance in University Hospital, signs warn flu.
The key a lot of infectious diseases is to keep it contained.
CU infectious disease Dr. Michelle Barron says it's not new for doctors to tell patients who might be infectious to stay home and just call.
The danger of having somebody that's infectious sitting in a waiting room is that other people that are around them then can get sick and then continue to spread the flu.
But beyond just calling your doctor, there's a growing trend of telemedicine. You can get on your computer, log into a virtual waiting room, and connect with the doctor. Jennifer McClendon is a physician's assistant in Arizona who also treats patients from Colorado online.
I can tell that they're not in any acute distress over the webcam. I can tell that they're breathing well. Basically, treat them based on what they tell us, which is very similar to what I do in practice.
Doctors tell us high-risk patients or more serious cases would still need to see a doctor in person. The key is being able to give a good history, your symptoms and risk factors. And if prescribed antiviral medication on the phone or online, have someone else pick it up for you.
It's actually a really good concept of just kind of semi-quarantining the person, and if you can facilitate that through telemedicine, it's actually would be a really nice thing.
Reporting live, Jacqueline Allen, 7 News.